We often hear terms like SpLD, dyslexia, ADHD, but do you know what they actually mean? Specific learning disorder SpLD refers to difficulties in specific learning skills such as reading, math, or language despite having normal intelligence. These disorders typically begin during a child's school years and may persist into adulthood, affecting academic, social, and professional development. There are 5 main types of SpLD. Number 1. Dyslexia. Commonly defined as a learning difficulty that primarily affects the skills of accurate and fluent word reading and spelling. Dyslexia is characterized by difficulties in phonological awareness, understanding the sound components of language, verbal memory, and verbal processing speed. Typical manifestations include confusing similar-looking letters, for example B and D, slow reading with skipped lines or omitted words, and frequent spelling errors. Number 2. Dysgraphia. A writing disorder that may present as illegible handwriting and difficulty putting thoughts onto paper. Number 3. Dyscalculia. A lifelong learning difficulty involving math, marked by a lack of arithmetic skills. Symptoms include an inability to understand the meaning of numerical symbols and difficulty mastering basic operations like addition and subtraction. For example, understanding that 3 represents a quantity or that 1 plus 1 equals 2. Number 4. Dyspraxia, developmental coordination disorder, DCD. Often associated with coordination difficulties, also known as clumsy child syndrome. However, about 50% of individuals with ADHD also have DCD. Number 5. Mixed SpLD. There is overlap among skills such as writing, reading, listening, speaking, and reasoning, so some people are diagnosed with multiple learning disorders SpLD. For example, dyslexia plus dysgraphia, or DCD plus dyscalculia. Attention deficit hyperactivity disorder ADHD is a neurodevelopmental disorder characterized by persistent inattention, hyperactivity, and impulsive emotions. It often begins in childhood, with most cases emerging during preschool years. It is mainly divided into 2 types: childhood or adolescent ADHD and adult ADHD. ADHD has 3 subtypes: inattentive type, short attention span, procrastination. For example, difficulty sustaining focus during lectures or homework, frequent omissions or errors in assignments, inability to filter out irrelevant stimuli, and often losing or misplacing things. Hyperactive or impulsive type. Excessive activity and impulsive emotional behavior, often overly excited or prone to low moods due to frustration, leading to oppositional or aggressive behaviors. For example, fidgeting, interrupting others, or acting aggressively. Combined type exhibits features of both. However, 35–50% of individuals with ADHD have at least one SpLD.